As you begin to look into healthcare analytics, you may find yourself searching for definitions and differences between health informatics, bioinformatics, and healthcare analytics. It's not hard to see why, as the three disciplines work in similar areas of the health, computing, and IT space. But in fact, they are very different and have uniquely defined roles that complement one another. Health analytics and informatics are both essential for the success of healthcare organizations. Healthcare organizations must be able to manage, analyze, and interpret data in order to identify the best ways to deliver high-quality care. Although some consider analytics and informatics to be interchangeable terms, the two are distinctively different in concept and practice. Health informatics is the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare services delivery, management, and planning. In practical terms, healthcare informatics relates to the ecosystem of data and systems that support operational and clinical workflows rather than the analysis of data found therein. The diagram depicts the relationship between the two major domains of health informatics: health information technology, which focuses on the tools and machines, and health information management, focuses on the organization and dissemination of information. Example of the job scope of a health informaticist may include managing EHR integration into clinical workflows, reduce health disparities, engage patients and families, improve care coordination, maintain privacy of health information, improve access to health information, and improve education and compliance. Healthcare analytics, on the other hand, refers to analysis of the data to inform decisions, improve quality and performance of the healthcare organization. Health data analysts have the advanced knowledge to acquire, manage, analyze, interpret, and transform data into accurate, consistent, and timely information. Example of the job scope of a health data analyst may include increase access to care and decrease costs using business analytics, overcome reimbursement challenges using smart algorithm, improve patient outcomes using big data analytics, optimize resources using descriptive analytics, conduct research using advanced analytics, improve clinical quality using operational analytics, and detect fraud using prescriptive and real-time analytics. Another field of prominent importance in the field of analytics and informatics is bioinformatics. Bioinformatics focus on analysis, interpretation, data mining, and integration of heterogeneous omics data, including the genome, transcriptome, proteome, metabolome, and algorithmic modeling of biological systems. It has two roles. As a technology, bioinformatics is a powerful technology to manage, search, and analyze big data in life sciences. As a methodology, bioinformatics is a top-down holistic, data-driven, genome-wide, and systems approach that generates new hypotheses, finds new patterns, and discovers new functional elements. It complements traditional experimental biology methods. A seamless combination of computational and experimental methods should be the best way to study a biological question. The bio in bioinformatics signifies the biological questions it studies, many of which can be grouped under the conceptual framework from genotype to phenotype and the central dogma. Some examples may help you understand better. For instance, sequence alignment. Are the sequences of two genes or proteins similar? Could they be homologous? How can we find the closest homologue of the gene we are studying from the vast databases? Can I use the known function of a known gene to guide the study of my gene of interest? Given DNA and genome sequences, how can we find the genes in the vast genome? How can we compare the similarity and difference between two whole genomes and reconstruct the evolutionary history? What are the syntenic regions between two genomes? How can we identify which genomic regions are methylated? At the level of RNA expression, we often need to find out which genes are differentially expressed between two organs or tissues, between tumor and normal tissues, or between two different developmental stages. At the level of proteins, how do you identify the expressed proteins from mass spec data? Proteins do not exist in a linear form in nature. Instead, they are folded into beautiful three-dimensional structures in nature. How can we predict the three-dimensional structure of a protein from its sequence? Molecules do not exist or function in isolation. Instead, they form complex molecular network. How can we construct protein-protein interaction networks, transcription regulation networks, and metabolic and signaling pathways? What are the dynamic features of these networks? Furthermore, with these data and researches, how can we simulate a virtual cell? Last but not least, how do you compare different people's genomes and use population genetic approaches to compare the genomes of the ill and the healthy, and identify the gene mutations that cause diseases? From these examples, we can see that there are many interesting and important questions in life sciences that await our bioinformatics investigation. Seeing bioinformatics from another angle, the informatics in bioinformatics signifies the information and computational methods to manage, search, and analyze the data. The theme runs along the axis from data to discovery. First, the storage, index, and search of terabytes to petabytes of big data require advanced databases. Just imagine, your laptop probably has several gigabytes of hard disk. However, just one set of our experiments often generates 1 or more terabytes of data, which is too large to fit in your laptop. Managing such big data requires advanced database systems. Analysis of noisy big data requires the development of many algorithms, software tools, and web servers. These make up a big portion of bioinformatics research. A tradition in bioinformatics, since the early days till today, has been to make most algorithms and software open source. This has contributed significantly to the broader life science research, and had helped to advance bioinformatics itself as well. With these tools, we can do a lot of data mining to discover new patterns and phenomena in life science. Finally, by integration of data and tools, we can build predictive models of biological systems. As more and more high-throughput technologies are used more and more in life science, there will continue to be numerous new opportunities for technology innovation in bioinformatics. To meet this challenge, a new breed of professional that could collaborate and communicate with biomedical researchers, clinicians, quantitative scientists, and bioethicists is needed to translate the genomic knowledge to improve patient outcomes. In summary, healthcare analytics, health informatics, or bioinformatics are basically tools transform raw biological, patient and prescription data into meaningful and useful information used to enable more effective strategic, tactical, operational insights, and decision-making. Data is now available more digitally as technical advances have made it easier to collect and analyze information from multiple sources. The government, regulatory agency and other public stakeholders have been opening their vast stores of healthcare knowledge, including data from clinical trials and information on patients covered under public registry programs. In parallel, pharmaceutical companies have been aggregating years of research and development data into medical databases, while payers and providers have digitized their patient records in EHR. As healthcare becomes a greater portion of expenses for employers, public, private, and patients, there is an increasing focus on analytics to drive efficiency and value. Therefore, it is important that the best data analytics and informatics professionals collaborate on transforming the way data is gathered, maintained, and analyzed through technology solutions. Healthcare analyst, health informaticist, and bioinformatician need to integrate and collaborate with clinicians and experts who understand the healthcare system and use data analytics and leveraging the strengths of each profession effectively. Working as a team, informatics and analytics professionals are bridging the gaps and introducing action-oriented improvement opportunities with the intention and potential of improving healthcare safety, quality, efficiency, and cost of care.